We have an excellent roster of speakers today to discuss the impact that rehabilitative and habilitative services and devices have on people's lives. Whatever healthcare reform Congress passes, it must preserve access to rehabilitative and habilitative services and devices. And by the way, that is a category of essential health benefits. And it's created a federal standard in this country, which is critical. And many of the states, obviously the vast majority of the states, have plans that cover the types of services and devices that we'll be talking about today. And any health reform bill that undercuts that coverage is of great concern to this community. When I was 10 years old, I was involved in a car accident, lost both my legs below the knees, and went to 2.5 months of inpatient rehabilitation, experienced outpatient therapy, walked today on artificial limbs. I've had 13 sets of artificial limbs over the past 43 years. And I'm working, I'm raising a family, I've got a very active lifestyle, and many of the people in this room are just like me. Who knows rehabilitation on the Republican side who'd be willing to do this at short notice, extremely short notice? And I thought of Congressman Glenn Thompson.
Well, good afternoon, everyone, and thank you. Peter, thanks for thinking of me. It really is what a privilege and honor to be able to be here, and a privilege and honor to be here with the senator and to fill in for a good friend of mine. For me, this is like old home week for me. As I like to say, back when I had a real job. I served for 28 years, working each and every day with individuals who were living with and facing life-changing disease and disability. And it was just a privilege and honor. It'll be the highlight, after my children and my wife, the highlight of my life, being able to interact with individuals and to work together, to come up, do our best to develop those cost-effective treatment plans, to be able to make a difference in people's life. There's a saying that when it comes to public policy, if you're not at the table, you're probably on the menu. I learned that as a very young recreational therapist and a rehabilitation services manager then, working on public policy issues, trying to bring the concerns of the clients, the patients, the consumers, my friends that I had the privilege and honor of working with on a daily basis, to bring it to the table and to make sure that you have that voice. And at the beginning of this Congress, I reintroduced the Access to Inpatient Rehabilitation Therapy Act of 2017, as well as the Medicare Orthotics and Prosthetics Improvement Act of 2017. The Access to Inpatient Rehabilitation Therapy Act removes arbitrary barriers to those in need of within the comprehensive rehab setting, barriers where physiatrists deem that recreational therapy is medically necessary and appropriate. We have qualified, credentialed providers who are not creating harm for consumers, number one, and number two, not defrauding the taxpayers. And so this piece of legislation, very proud of both those pieces of legislation. My vision of rehabilitation is it's twofold. It restores lives and it secures futures. And so that was my commitment. That was my philosophy when I practiced rehabilitation services for almost 30 years, and certainly is what drives me now as a member of the United States House of Representatives.
As we conclude, I need to say that when we first put on this briefing, or decided to host this briefing, we had no idea that we would be putting it on the same week that the Senate is actually considering taking a vote on a healthcare reform bill that addresses and that would impact to such a great degree access to rehabilitative and habilitative services and devices. In the closing minute or two, I just need to impress upon you, this is not a partisan comment. It's frankly just an objective analysis. The current Senate bill would eliminate essential health benefits in the Medicaid expansion states. And so it would repeal essential health benefits, of which rehabilitative and habilitative services and devices is one of those categories of benefits. It would allow the states to define essential health benefits in private plans, individual and small group plans, and no longer have a federal standard for essential health benefits at the federal level, something that we've enjoyed for the last 6 or 7 years. It would ultimately, from what the CBO says, the Congressional Budget Office estimates that it would reduce coverage in this country by 22 million people. And of course, if you don't have health care coverage, you don't have coverage of rehabilitative services and devices and habilitation. So this is of great concern to everyone who cares about these benefits, and even to those who may not even think about these benefits. This care knows no bounds, and the statement's been made before. It's not a partisan issue. This is care that is the very definition of insurance. Who expects they'll wake up and need an artificial limb or a wheelchair or any one of the types of rehabilitative care that you've heard about today? It really is the definition of health insurance. And so we leave you with that statement. We thank very much the panelists. We thank you especially for coming. And thank you so much. And the briefing is now concluded. Thank you.